Hi everyone, my name is Alyssa Reese and I'm a first year medical student at the Jacobs School of Medicine. I do research at Dent Neurological Institute and today I'll be discussing medical cannabis as a plausible replacement for current anxiety and depression medications. So you all may be familiar with anxiety disorder or major depressive disorder as it's very common in the United States. In fact, 31.1% of US adults experience anxiety disorder during their life, and in 2017, approximately 11 million US adults were severely impaired by a major depressive episode. And with the COVID pandemic, I'm sure these numbers have increased. And currently, the treatment methods for anxiety and major depressive disorder aren't great. They come with a variety of side effects, and it's often difficult to get the best dose for the patient, and they may have to change medications and dosing frequently in order to find something that works for them. So, one of my research questions for my literature review asked what is the overlap between the mechanisms of the current anti anxiety and antidepressant medications with cannabinoids? And using this knowledge, what are the potential implications of replacing current anxiety and depression medications with medical cannabis? So, some background about the medical cannabis plant. We have the cannabis plant and many different compounds within it. So, you may be familiar with THC and CBD. THC is known for being the more psychoactive ingredient, while CBD is known for being the more calming or soothing ingredient. And then there's also a variety of phytochemicals, which we still don't know that much about, but we do know that they could potentially have different effects. So the different levels of the THC, the CBD, and the phytochemicals can lead to different effects on the human body. But how does our brain know how to react to these substances? Because we can take in many different substances, but why would it cause a psychoactive effect versus a calming effect? Well, we already have a system that has cannabinoids in it. So this is called the endogenous cannabinoid system. And we have endogenous cannabinoids such as 2-AG and AEA. And these are just substances in our body that act like medical cannabis. And what these do is that they bind to cannabinoid receptors and they act as chemical messengers. And in turn, when they interact with these receptors, they can release more messengers. And these chemical messengers are commonly referred to as neurotransmitters, and they can have a variety of effects on the body. So basically, medical cannabis can act just like the body's natural endocannabinoids and use the same exact system to exert a variety of different effects. So my literature review revealed promising data from studies that demonstrated positive effects of medication substitution based on mechanism overlap. What I found was that the medications that are used for anxiety and MDD are very similar in terms of their mechanism to medical cannabis. They can alter chemical messengers such as serotonin, dopamine, and GABA in very similar ways in order to have a positive effect on the human patient. So you can see here that we have separate anxiety and separate medical cannabis treatments, but in actuality, these can actually overlap and have very similar effects on your neurotransmitters and the effects that they can have positively on the body. So one recent retrospective chart analysis at Dent, which basically just means that we looked at old charts, found that patients with both anxiety and depression, when taking medical cannabis, had great benefit from it. So we had 101 patients with anxiety and depression, and 88% of those participants had symptomatic benefit from medical cannabis. And we also saw that they reduced their medication use. So benzodiazepine and SSRIs and SNRIs are medications used for anxiety and MDD. And we found that the benzodiazepine use reduced by 42.57% in participants. Um, and then the anxiety and MDD medications, such as SSRIs, reduced in 20.79% of participants. So, as you can see from this study, it shows that substituting those anxiety and depression medications with medical cannabis may be beneficial for patients. And multiple other studies corroborated this as well. So, what comes next with this research? Obviously, I couldn't cover too much today, but we're really looking at randomized controlled clinical trials, basically just experiments where we can really see what the effects of the medical cannabis is and realize why the medical cannabis is working similarly to the medications for anxiety and depression. We also want to advocate for quality insurance and make sure we have proper ratios of THC, CBD, and those phytochemicals I was talking about so we can kind of narrow down what effect it will have based on the ratios of those ingredients. And then just more retrospective studies to evaluate medical cannabis are always important in order to see how medical cannabis can affect a variety of conditions. And that concludes my presentation. If you have any questions, feel free to reach out to me at adreese@buffalo.edu. Thank you and have a great day.